Hi. Just a follow-up of the COVID-19 cases, but again, earlier video I mentioned that I was optimistic, cautious but optimistic. But I wanted to give you some updates, as in like the detail. So let's start. Let me actually go into the screen share so you can actually see analysis. Let's see. So if I do this, I think you'll be okay. So now, so so I wrote down a couple of things down here, but then so you can actually see it. So I mentioned about moving average. So when you look at the actual data, so when you look at actual data, you would see that going from 594 through 1057, and then it looks like almost like double the number, and then double the number here, and then number goes up, but then it goes down, and each day it goes up and down, or sometimes it just doesn't go up as much. It's hard to see. So in order to see the general trend, the easiest way to do for the general trend is to use the moving average. Again, moving average is again, you would see moving average in the stock trading when you see the general trend. If you look at the stock chart, like the equity trading and all this, the stock trading chart, you can actually look at the past 5 days average of that particular price of the stock that you are interested in looking at. So if you look at the past 5 days average, and every day it's so moving on to 1 days, and you look at the 5 days in the past from that date. So every day you can look at the past, whatever the day that you decide to look at, and then you can look at 5-day average or 10-day average, and then you can see the general trend. Longer the days, the flattened, the more general trend you can look at. And I looked at a couple possible days, but actually just used a 3-day moving average, because again there are many days for the COVID-19 cases, just so that you can smoothen out all these localized bumps. So what you're looking at here, so I'm going to actually show you what you're looking at here is the moving average of 3 days. So if you look at these 3 days, so 594, 1057, 2697. If you take 3-day average, and that happens to be 1499, I just calculated and I just fill that in. So if you do the next day would be the green line. So if you look at the this date and then moving average of these 3 days, and then it happens to be 2324. And if you do this, again, likewise, you can do that for these 3 days, or you can do that for these 3 days, and then you just move on every day, and then you just look at the past 3-day averages. So the numbers looks like 1499, so, and then 2000, 2590, 3000 or so, and 4000 something. So in this case, and then if you look at the general trend wise, the day before, by the way, I looked at this number as well, the moving average over the past 3 days right here, these 3 days, and it happens to be like 690 something. So turned out that the previous day into this 1499, there was a big bump of like but it went up by about 2.5, and then but from that point onward, and this is the reason why I say I'm pretty optimistic. From that point onward, it's pretty much about 1.5. It's actually less than 1.5. It's like almost like 1.1 to 1.2. So 1.1 to like 1.3, but it's 1.2 range. So it's not catastrophically bad, and that's what I mean by it's not actually moving average of like like 2, like you would see here. If we see a moving average of 2, that means the numbers of infection or number of confirmed cases double and double and double. But in this case, it's not. It's it's closer to 1 than 2, which is good. And so I'll give you an example, the reason why. And this is really encouraging. So, and also I'd like you to stay hopeful on this one, because I think this, and this is what I mean by, number of new infection will probably start going down after, maybe 3 to 4 weeks. Um, so again, remember, the United States have almost 300 million people in terms of population. So number of infections will inherently will go up, and number of death will be inherently go up because we have a high population here. So that's the reason. It sounds scary, but if you look at the actual percentage, and I'm going to actually talk about the in the next video, I'm going to talk about actually how well we are actually equipped to handle this. So it's very encouraging. So I'd like you to spread the word. I'd like you to spread the word in, in terms of like being optimistic, but I'd like you to spread the word that we are actually should be encouraged in our ability to be able to handle this. And I emphasize this. There are only like two countries there are only two countries in the world that actually have been handling this epidemic case pretty well. Only two countries, and U.S. is one of them. So anyways, this is what I mean by infection ratio, closer to 1 is good. So let's just assume that the infection ratio is 1 to 2. So it's going to be double and double and double. So in this case, double and double, double. So if you have, black means infected persons being infected. So one person, in this case, infect like say 2 people. So, one person just goes to, 2 people, and then 2 people going to 4, and that would be really bad. That's not the case right now, at least in the past few days for state of New York, by the way. And it could change. Again, state of New York, I think it's handling it pretty well. And I think, same thing for Pennsylvania, Delaware, around the eastern part of the state, except that Florida. I'm going to go to the Florida in a minute, but going back, just to give you some idea. So let's say infection rate is 1 to 1. So let's look at, 1 to 1 case, right? So let me erase this. So 1 to 1 means if one person is going to infect one more person, and this person will have other encounters, but only one person is transmitting to 1 to 1. That's fine, right? So that's, oops, that's just that's not what I wanted to do. So let me erase this. So now let's look at the infection case of 1 to half a person. Of course, you can't infect half a person, so it's somewhat hard to draw. So, but let's just assume 1 to 1, 0.5. So in this case, so one person is infecting half a person. So it's either like nothing would happen or infect one person. So in this case, I just made the example here. In this case, so let's say this person, right, infects another person. It's 1 to 1, or in this case, 1 to 2. But let's say, from this point onward, let's look at this case situation, 1 to 1 case. So it gets messy. So let me erase that. All right. So now, one person is infecting. So now another person. So for the sake of simplicity, let's think of this part right here. So now. So in this case, this person could infect this person or not. But, again, for the situation here, all the way, let's go down. So in this case, 2 people are infecting 1 person, let's say. The reason why I just put this X mark here is because, this person is infecting this person. So this person can't really infect this person. So, I just made the case here, just a model case. But in this case, 2 people are infecting 1 person. So ratio is 1 to 0.5. That's where we want to go to. The reason why is because, again, the next generation, in this case, these people will not infect because these people are already done, tested negative, and hopefully these are not false negatives, and then these people actually don't infect more. But this person right here, will infect, will let's say have an encounter 2 people. I mean, it could be 4 people, and then you can just do, and then 0.5 would be, 4 people. But again, it's again one or the other. But anyways, just for the sake of simplicity, just 2 people here. So if it's 1.0.5, the cases in this case it would be, it's either one person is definitely not, but the other person it's either this or this. So it's either cases. So if again, if it's 0.5, that means the person either infect the other person, that would be 1-to-1. And the other case would be, the person may not, will not infect. So it's 1-to-0. So it's basically, and then overall average will come out as 1-to-1.5. But infection, this case, number of infection or number of cases in this case will start going down because it's either infected or not infected. So if you don't have infected cases, then guess what? You only have 2 people here who are not infected. That means that's, again, number will start going down, and eventually this will start subsiding again. So yes, the number looks scary. Yes, right now, as of today, we have about 30,000 cases, and it will probably continue going up. But if you can actually slow down the case, then that would be good, because hospital healthcare system wouldn't be saturated, and they can actually focus on people who are in need for the intensive care. And then as you get ill, you can still be treated, unlike Italy, or unlike like China, or unlike France. So Spain is getting close to the point. But the point is that we are still in very good situation. I wouldn't call it very good situation, very good handling of this situation. So remember, we want to keep the infection rate less than 1, and eventually it'll subside. So keep that in mind. To do that, we just have to stay home. That's important. And also we wash hands. If possible, if you have a bleach, you can always bleach the surface. I wouldn't use it for the hand and stuff, because that's going to dry your hand and skin. But typical surfaces you can definitely disinfect if you have exposure to things like outside, if you go to grocery store or something. Again, in the next videos, I'm going to show you how to actually make the diluted bleach. Of course, you probably know that anyways, but I'll do that. And so let's stay focused, and again, stay I mean, like it's hard, it's easy for me to say let's stay positive, but there's an actual evidence right here that we can actually be encouraged and be positive about this. So again, thank you very much for watching, and I'll see you in next video.